here is your question. All right, so if you have read and understood, considering it history-taking station, please begin.
Okay, good evening. My name is Dr. Daniel Raza, and I am a surgical doctor. I would like to confirm your name and age, please.
Good evening. I am Miss Linda Robert, 35-year-old. Nice to
Thank
meet
you.
you.
Nice to meet you, Mrs. Linda. So today I'll be asking a few questions regarding your health. Is that okay?
It's okay. Okay, yeah.
All right. So what has brought you here today?
Yeah, I got the pain around in my tummy about the umbilical.
All right. So sorry to hear about that. So since when you have been having this complaint?
You know, it's less yesterday. It's the pain started yesterday and it's began worsen.
All right. So did it start suddenly or gradually?
Yeah, it's the suddenly. Yeah.
Okay. So can you tell me exactly, can you point out the pain for me? Where's the site?
Yeah, it's like that in my upper abdomen.
All right. So, and how would you explain the pain to me? Is it very sharp, burning, or cramping in nature?
And I think it's pain in nature.
All right. So, does it go anywhere else or does it stay here only?
I think sometimes it's go to my back. I feel also back pain too.
All right. So, makes it worse and what makes it better?
When I move around or when I eating, the pain become worsen. Um,
All right.
when I lying down or taking some drug,
Okay.
it become release. Yeah.
All right. So, is it any specific time in a day when it gets worse?
No, I didn't know that like that.
All right. So, on a scale of 1 to 10, considering 10 is the highest number, how would you rate the pain?
Yeah, I will get the pain around 8 or 9 cents. Yeah, it's very painful. Yeah.
All right. I'm so sorry to hear about that. So, does the pain relieve when you bend forward?
I think so. Yeah.
All right. So does it move to your right shoulder?
I don't think.
All right. So have you noticed any yellowish discoloration of your eyes and pee?
Mm, I didn't know that about that.
All right. So did you throw up?
Yeah, I threw
And
that 3 times today.
all right. So and how many times did you throw up?
3 times.
All right. And was there blood in it?
I don't think so. It only contains some saliva and some,
All right.
yeah, some
So
awful, yeah.
so do you feel any metallic taste at the back of your mouth?
No,
All right. So do you have any heart problems before?
no,
All right. So do you feel any discomfort in your chest?
mm, I don't think so, yeah. But the pain is very wasn't in my tummy.
Okay. And what about the stools? Do you notice any blood in your stools?
Uh, I don't, I don't know that any, but I still stick to the commode. It's
Okay.
difficult to flash down.
All right. All right. So, do you see your GP for any other medical conditions?
No,
Okay. So, have you ever been hospitalized before?
uh, no.
All right. So, do you take any medications regularly?
Yeah, I think Sandra, I got it. I had the diabetes.
All right. So, do you have any allergies to any drugs or foods?
I don't know that.
All right. So is there anyone in your family have been having the same complaint?
No.
All right. So Mrs. Lisa, do you mind if I ask you some personal questions?
Yeah, okay, go on.
Okay. So what do you do for a living?
Yeah, I have the office staff.
Okay. And whom do you live with?
I live with my wife, yeah.
All right. So do you drink alcohol?
Yeah, I usually drink alcohol.
And how many units per week?
Yeah, before that, I thought already had a border on that day. Before that day, yeah.
All right. So have you considered it quitting?
Not now, yeah.
Okay. So do you smoke?
Yeah, I sometimes smoke, yeah. When I feel stressed, I
O-
go for
Okay.
smoking.
All right. So before we go any further, I would like to ask you, what do you think the cause of your pain is?
Yeah, I worry there may be sending back in my tummy because it's very painful.
All right. So, and what are you most concerned about?
Yeah, I'm concerned about, I'm afraid of something is perforating in my abdomen, in my tummy, and it's where, because I'm very painful now. Yeah.
And what are you hoping us to do for you?
Yeah, you guys will help me to release my pain and cure my disease.
Sure, your concerns are genuine, and we will try our best to manage it. So, I will quickly scan all your symptoms. So, have you ever had any history of passing out?
Sorry?
Have you ever had any history of passing out?
Okay.
Oh, no.
Can you summarize your history taking now, please?
Yes. We have 35 years old lady, Mrs. Linda. He presented to us with the complaint of a sudden onset of severe epigastric pain for the last 1 day. And the pain was moderate to severe in intensity, and that rates around 8 on a scale of 1 to 10. The pain radiates to the back and radiates to the back and aggravated on food intake. And it is relieved on bending forwards. The pain was associated with the history of vomiting that contained no blood. And my patient is a known alcoholic, and she drinks around half a bottle of vodka per day.
Okay. So considering these history of the patient, what are your provisional and differential diagnosis?
Yes, ma'am. My provisional diagnosis is acute pancreatitis, and differential diagnosis includes perforated peptic ulcer disease,
Okay.
uh, chronic pancreatitis,
And
acute mesenteric ischemia, acute myocardial infarction.
all right. Can you tell me how would you confirm your diagnosis? What investigations would you ask for?
Yes, I would run a baseline routine blood investigations that includes a full blood count, urea creatinine electrolyte, LFTs, and serum amylase and lipase to confirm for the acute pancreatitis. And I would also do the X-ray chest to rule out perforated peptic ulcer disease.
What treatment can you suggest this lady?
Yes, as this patient is really sick, so I will manage this patient according to the care of critically ill surgical patient protocol with the
Yes.
ABCD approach.
Yes.
And I would attach a cardiac monitor to assess the oxygen saturation and check for the if the airway is patent or not. I would put on IV cannula and start with the painkillers as the patient is in severe pain, and starts with the IV hydration and antibiotics. I would look for any disability and examine the patient on exploring the exposure of the critical secrets protocol.
And
And I would manage this patient in the high dependency unit and continue managing on according to the secrets protocol. I would continue resuscitation on the according to her maintenance body fluids requirement, and continue IV analgesics and painkillers and look for the worsening signs.
and
And I would also go for the CT scan, abdomen, and pelvis according to the pancreatic protocol to look for the pancreatitis.
yes, and two more things you can still add. and they're very important.
Uh,
Okay, bell went. I give you 1 extra minute for discussion. Okay,
okay.
thank
Okay.
you. Oops. Right.